name is Dr. Joshua Malley. I'm a board-certified ophthalmologist and fellowship-trained vitreoretinal surgeon. I'm also the founder and CEO of Malley Enterprises. Additionally, I serve as the Retina Medical Director of the Macular Degeneration Association. I'm so honored to be here today to be the host of this video series, and I'm hoping this will be a great series to talk about hot topics in retina, and I hope this will help to bring on discussion, education among all retina specialists. I'd like to first thank Ophthalmology 360 for this opportunity to be the host of this exceptional video series. For this first inaugural episode, I'd like to discuss a very hot topic in retina and ophthalmology, frankly, is artificial intelligence. We've seen our technology really expand, especially the last 5 to 10 years, and we've seen it in multiple sectors, and certainly it's now made its way into retina. But one particular device that has really taken a hold, especially in the last couple of years, is the 4C Home device, which is a FDA-approved device for the home that helps to detect changes from the wet form of macular degeneration in patients with dry AMD. If we're able to find that, conversion to wet AMD as fast as possible, we're able to get patients a better outcome. So certainly a very critical technology that I use in my practice currently. I'm very successfully been able to catch patients at their time of conversion from dry to wet macular degeneration and get them treatment as soon as possible. So certainly I think this is a great topic to discuss and really shows how artificial intelligence and telemedicine can be implemented very successfully in the retina space. First, I want to talk about what is the 4C Home device. It's a small device that patients can use at home. They check each eye individually, and it's based on a principle called preferential hyperacuity perimetry, which basically helps to form a metamorphopsia map of each patient's retina and helps to detect occurrences of areas of metamorphopsia in their visual field. It's critical technology to use, and it's very good at detecting changes. And for example, in the home study, which was the large clinical trial looking at this device in patients, what they found was that the percentage of patients that maintained 20/40 vision or better, which was considered good functional vision, was significant in the 4C Home group versus standard of care only. So you had two groups. You had the 4C Home patients that were on 4C Home, as well as standard of care, which was Amsler grid, patient-reported symptoms, as well as routine visits. So between the two groups, the 4C Home group, 91% of patients were able to maintain that good functional vision of 20/40 or better, versus only 62% in their standard of care only group. So you can see there that this is a huge benefit for patients. So there's a lot of data behind it and its implementation in clinical retinal medicine. So I thought the best way to really also show that was to show a case study. And again, for those of you that are unfamiliar with the technology, the way it works is if it detects a change in the patient's vision that's significant, it actually will report to the physician of that change and call the physician's office in order to report that, and then you call the patient and you bring them in to examine them. So I'd like to start with the case of my patient. In slide 1, we have a 75-year-old female with a history of wet AMD in her left eye. She was receiving Eylea at the time, and she's a history of dry AMD in her right eye. She's very active, a world traveler, so very active patient. She's completely, I started her on 4C Home in 2016, and she actually alerted in March of 2017. She was completely asymptomatic, but called her in right away. On a clinical exam, her vision in her right eye was 20/30, her left eye was 21/50. On her fundus exam, there was a very small area of possible subretinal fluid, just nasal to the fovea on exam. As you can see, I show a fundus photo of her right eye, which really doesn't show any hemorrhage or anything, just some RP changes. Very kind of unremarkable fundus photo otherwise. On slide 2, you can see here, this is the actual 4C Home report that you get. And you can see at the bottom there, that red area on the metamorphopsia map, that's significant metamorphopsia that has changed from her baseline. So something is going on here. Of course, I ordered an optical coherence tomography scan. That's shown on slide 3. And you can see there's a very small nasal PED with some trace hyper-reflective subretinal material, but no frank subretinal fluid. So because my high suspicion, because the forcing home alert, I got a fluorescein angiography on her, and of course that was helpful to confirm the CNV leak. So you can see here on slide 4 that was really helpful to confirm the CNV lesion and confirm her wet AMD diagnosis and conversion. So on slide 5, you can see her clinical course. She received Eylea in her right eye. She's currently now on 8 weeks. She's doing very well after almost 4 years of treatment. She's 20/25 in her right eye. So the key points I think this case highlights is making sure that you get patients on this device that are eligible to have forcing home. Take the alerts seriously because they can be very atypical presentations. Patients can be asymptomatic, so that's really important to examine these patients when you get alerts. Kind of key rule is that if obviously the wet AMD is diagnosed earlier, patients usually always get a better outcome. And it's critical in her case because she was essentially monocular. Her other eye had been affected by wet AMD, so really shows the benefit of having a device and artificial intelligence in retina today. So really we're lucky, living a great time to have all these devices at our fingertips to help patients to get the best possible outcome. I'd like to thank everybody for listening to this first episode of this series, and very excited to bring you many more. Thank you very much.